I'm here with one of my lovely patients that has a very unusual problem, and we're trying to help him. And I want to describe this problem so our audience who may be affected by this type of problem can have a better understanding and have potential option and consideration in treating this type of problem. This gentleman is 57 years old and he is extremely fit and he works out religiously. And a few years ago, he had some gynecomastia and he was treated by another surgeon somewhere in California, and he ended up having an issue of over-resection. Now, this can happen in anybody's hands, and this is an unfortunate situation, and the issues are multiple reasons, but we don't want to concentrate on that. We want to concentrate and focus on how we're going to treat this. When he went back to his doctor, he discussed potentially doing a resection and then moving his nipples up and to be able to deal with the over-resected area in this area. That is one option, certainly, but that's gonna, unfortunately, the nipple grafting or moving a scar in this area is never a pretty option, and is going to basically destroy his physique, and it's going to cause problems. So after evaluating him, we came up with an option to go into his axilla and reduce the skin in this manner. You can quickly see how beautifully that fixes this area, but that doesn't completely address this area. He's got some extra tissue, fatty tissue over here that we're going to reduce, and this area needs to also be grafted. The other problem is he doesn't have any much fat, so we're going to have to get and harvest some fat to do fat implantation in this area, grafting. And again, you can see on this side too, if we can do this, and this is a lateral axillary tuck, we can restore his chest in a very effective and cosmetically appealing manner. He will have a scar in his axilla, but the scar is rather well hidden, and it's a much more effective means of addressing it. So subsequently, he came to us with a problem with over-resection and a lot of laxity of tissue in this area. And what that created was a very difficult deformity, because the only way we could have fixed that is to create an incision in this area and cut the skin out. That's what he was told from 5 different facilities that he went to fix this problem. And that wasn't acceptable to him to have an incision in this area. So we discussed it and we evaluated him, and we came up with a unique approach to solve this problem, which is a lateral posterior axillary tuck where the incision is hidden. And we cut elliptical tissue in this area and we pulled everything back. Subsequently, he has no more deficiency over here. We did fat graft this area a little bit to give it more improved cosmesis. And because he was very thin, it was difficult to harvest the fat. We created an even plate over here. Thank you for joining us. Hello, this is Dr. Mon. I'm here with my patient. We are now 1 month out, and we are going to see how the improvement on the chest has occurred. If you recall, this area was all laxed and there was a lot of increased divot in this area, a loss of fat and extra skin, and you can see all this is corrected. You can see all this is corrected beautifully, nicely. And his incisions and his lateral chest is all healing beautifully. And that's exactly what we anticipated and we wanted from this surgery. It's going to take a little bit more for the incisions to heal completely, and once that's done, he's going to be set. He can exercise and do what he wants. Thank you for joining us.